I am Dr. Joseph Roswarski. I treat patients here at MedStar Georgetown for non-Hodgkin lymphoma, Hodgkin lymphoma, chronic lymphocytic leukemia, and other B-cell malignancies. The most rewarding part of my work is to be able to interact with patients on a very frequent basis. Very frequently they have life-threatening diseases, and I'm able to interact with them and their families and offer them cutting-edge treatment for their disorders. Particularly in the field of lymphoid malignancies, we have a whole armamentarium of new targeted therapies, especially for B-cell malignancies, that I think are really starting to change the way that we're thinking about the approach to these diseases. I think the future is going to look a lot like we're using a lot less chemotherapy for the treatment of a vast array of hematological malignancies, and we're going to be using a lot more pills and immunotherapy, potentially in curative settings as well, where traditionally we have approached cure with just combination of chemo and antibodies. With advancements in targeted therapy and that moving more and more to the front line of treatment for patients, what that means for patients, right, is they have a very different toxicity profile than traditional chemoimmunotherapy. So what that means for the individual patient is probably less toxicity, but still achieving the same result, if not a better result. The thing that really motivates me every morning is a sense of duty and responsibility to my patients that I'm currently taking care of. I feel an immense responsibility for them and their families to make sure that I'm on top of their case, making sure that I'm reviewing everything about their labs and their imaging to make sure that I'm offering them the very best care that I can. There are a vast array of treatment options at MedStar Georgetown to include chemoimmunotherapy, immunotherapy alone, targeted medicine, CAR T-cell therapy, the bispecific antibodies. It really speaks to the importance and need for a specialist with expertise in hematologic malignancies, because there are so many options to choose from to make sure that the patient at that time gets the right treatment. I think second opinions are one of the most important things in the field of oncology. I've done the job previously of being a community oncologist, right, where you need to know every single malignancy under the sun. It's a very hard job. The field of oncology is rapidly advancing. There are new drugs that are coming out every single month. So for the community oncologist, it's very hard to keep up with the pace of medicine, right? So that's where academic medicine comes in. The ability for people with expertise to know everything that there is to know about that disorder, right? That's what we do here at MedStar Georgetown. And I think it's of crucial importance that patients seek second opinions at time of diagnosis, at time of relapse, right, or when things don't go right. I can't recommend that enough. My philosophy of care is to make sure that I have a strong rapport with both the patient and their family, to make sure that they understand their disease process to the best of their ability so that they can make informed decisions about their care. I've been involved with several different clinical trials, both at Walter Reed National Military Medical Center as well as the National Institutes of Health, in both B-cell malignancies and multiple myeloma. My work at the National Cancer Institute in multiple myeloma was around treating smoldering multiple myeloma with a regimen that we usually use for newly diagnosed multiple myeloma. And that was a great trial to be involved in. In the lymphoid malignancies, I was involved in several trials using novel targeted treatments in combination. This is something that I think is the future of medicine, particularly for non-Hodgkin lymphoma, and it's something I want to build on while I'm here at MedStar Georgetown. Targeted therapy refers to specific pathways that a cancer uses for its survival. And we utilize different pills generally to block those pathways so the tumor can't survive, right? So it is a growing field of medicine. We currently have dozens of different targeted therapies in non-Hodgkin's lymphoma, and I see the future just expanding more from there. When you come to MedStar Georgetown for care of your disorder, I think you'll be very relieved to know that you have a strong team around you that will make sure that things are done in a timely manner, that you have experts around you that are going to give you good explanations for what's going on and give you the best course of treatment available. We have a multidisciplinary team that really ensures that all facets of your care are taken care of. That ranges from having a dietitian, psychotherapy support, social support. We have amazing nurse coordinators who make sure that the logistics of your day-to-day care are streamlined. And at the top of that, right, you have amazing physicians here, right? Myself and Dr. Dunleavy really work together to make sure that we are in coordination and collaboration to ensure that patients have the best treatment options available. One of the great things about MedStar Georgetown is that we do offer a vast array of clinical trial options for patients. I believe a patient and their family should come to MedStar Georgetown because we have everything that they need for their treatment, ranging from frontline treatment to CAR T-cell therapy, to bispecific antibodies, to clinical trials. This is a one-stop shop for their disease.